This is a little bit more extended, in-depth explanation for the treatment of pilonidal cyst. Pilonidal cyst starts like a little pimple in the back, in the lower back, or in between the two gluteal as, and this develops sometime into an abscess that needs to be drained by a surgeon, or it drains spontaneously by itself. I wish all patients, they come to us at this stage, because the treatment is purely by laser and almost 100% cure. The problem, this gets repeated once and twice and 3 times, and they develop some more pimples in the midline, or sometime on the little upper side, and this how it starts, and they keep neglecting it, and they come to us at advanced stage, which also can be treated by laser, but it's a different procedure. The treatment of pilonidal cyst, just to make a long story short, has to incorporate a deep understanding of why it happens. And unfortunately, even surgeons, they don't read apparently what is the cause of pilonidal cyst. You have to understand that we were taught in the medical school that pilonidal cyst developed because of a congenital defect that exists in the gluteal sulcus. This is in the midline. That there is a remnant or residual sinus in that area that encourage the growth of bacteria and cause the pilonidal cyst. This is actually not true. What we discovered, us surgeons, and then it became a known knowledge, that it's mostly those people who have deep gluteal cleft, that where there is an anaerobic, this is anaerobic environment. This is the environment where bacteria that lives in anaerobic environment, where there's no air passing by, grow. And this what encourage actually the infection that happened deep in that sulcus, and that those bacteria overgrowth that's happening will follow those hair follicles, and will go down the follicle of the hair and penetrate the skin and start to form its own tunnel, where it likes to stay in this anaerobic environment. And that tunnel starts to extend further and further and further until it makes the pilonidal cyst, which appears as a flare-up from once in a while in an abscess formation. And the repeated failure of normal surgery, whether it's done by open big wound and leaving it open, or if it's closed, is caused directly by the lack of knowledge of the cause, the real cause. The real cause is there is a deep space which has no air in it. And you have to, in the advanced cases, you have to correct this problem, otherwise this will keep happening again and again. So, in short, for those pilonidal cysts in early stages and even intermediate stages, they can be treated purely by laser. We take advantage of the laser fiber technique. We've done thousands of these cases. They heal very well and they never come back. In those patients with advanced, cases where they have multiple openings, they're chronically infected, the patient is heavy set or obese, has some hirsutism, has excess hair, and has repeated infection stories. These patients, they need correction of the anatomy. If you don't correct that deep anaerobic environment, he will keep having this issue again. So what we do it also under local anesthesia with some sedation, we correct these abnormalities. And we have a special technique. We perform it purely by laser, sometimes with the scope and sometimes without. And the scope is not that important. A lot of people ask about VAFT. VAFT is something secondary. What's more important is what we do with the VAFT. So for those cases, we do the repair with a little plastic surgery in the site, no stitches on the outside. with nearly 100% cure, which is something that we never had in the past. But it is our case in Laven Clinic for the last 5 years, where we have essentially 0% recurrence because of this technique that we utilize the laser and we correct the real reason behind the pilonidal cyst. That's what gives us this results. And this could be done only in specialized centers. If you think as a general surgeon doing 1 or 2 a month that you can do this on a daily basis, that will be a mistake, because it's a learning curve, it's a collective experience, that's all what we do. And that's what I advise patients to follow, is actually to go to specialized centers that are specialized in these techniques, in laser advanced technique for the proctology in general, whether it's hemorrhoid, pilonidal fissure, fistula, or cyst, or warts, or whatever. So I hope that I explained, and I was trying to show some pictures with this video. I explained the issue of pilonidal cyst. It's very simple when it's done in the proper place. So I hope this will benefit everyone.